of the patient we are treating? Do they have the wherewithal? What you consider as bill here may just be your consultation fee elsewhere in the world, outside Nigerian shores, overseas. But because you cannot really remove these people from the total economic bondage we have now, the purchasing power is low. Begin to look at health insurance, for example, as a way out to do universal coverage of health insurance. People will be able to have healthcare coverage, and the issue will not be on billing problem again, not on affordability. You will not be able to listen to your physician when he's talking. You give him respect, but because you already have a bias, so he has finished my diagnosis. The next is to bring me bill now. Do I have all it takes? He's giving me this diagnosis because I want to tap my money. If you are on health insurance, this will not be your issue. The issue will be listening to the physician, developing confidence in that physician, allow him to do what is best for you. But even the money we pay overseas when we go for treatment is far more than what we'll have loved to pay here. Look at the ticketing, for example. Look at the accommodation when we get there. Look at how much we're going to spend. And yet, don't forget, in terms of life expectancy, Nigeria is placed 197 out of 200 nations by WHO. In terms of HIV death alone, mortality, Nigeria ranks second in the world. All of these things put together, it means some of these diseases, you see them almost freely on the road, almost freely with us. So when you come in, the doctor tries to diagnose you, tells you what you're suffering from, the fair bias you have. This doctor is also part of the society. He's actually looking for money. Look at his rickety car outside. Now I've entered. He's looking at my Jeep to bill me. He's looking at what, you see, all these things are things that are bordering on ethics. And then we need ethical revolution, honestly.
Speaking about that, I mean, you have people who on a regular basis talk about the fact that it's a combination of factors, not just the medical doctors, the pharmacists, the nurses, all these healthcare practitioners. They even tell you, even the basic things make them lose confidence in the health sector, because when you go to the hospital, the carelessness of nurses, those who are not even competent at that, the way they even attend to you, they even ask that, who is looking into all of this? Because a lot of people even comment and say, look, that leaves a lot to be desired.
Thank you very much. You see, there is this JCI. For you to be able to compete with the international market as a healthcare provider, for your facility to be noted, to be of international standard, for example, you need something like JCI accreditation. It took Laguna Hospital, for example, close to 7 years to build this. Whereas the Mercury Group, who will build this, normally elsewhere will use about 6 to 8 months to do it. The quality of the healthcare facility will stand one. Then the personnel that will come in will mean the name of that facility, because it is the human beings that are there working with the machines, the wherewithal, the waiting time, the kind of culture we have. Okay, look at what happens. You working in Ikoyi, for example, I come from Badagry in the morning. Before you get to your place of work with the traffic jam and everything, you are a healthcare worker. You see the stress and strain you go through. By the time you get there, you take some hours to get yourself settled. The next patient coming on board, for example, may work on your nerves. Don't also forget that even patients too, under the guise that patients are always right, customers are right, they're expecting so much in a community or in a society where our expectations are not usually met. For example, we seem to live in dreamers land. We had independence in 1960. We need to also be praying now for a rebirth, another independence, for God to deliver us from ourselves. The first time we had independence was to deliver us from the imperialists, from colonialists. But right now, we are the problems of ourselves. We now begin to have another independence, ask for another one, which is God deliver us from ourselves. And I think by the time we get to that level, ethical revolution will come in, our culture will change, attitude will change. The patient will also see the doctor as a human being or the nurse as a human being. And when you're coming in, respect begets respect. As he's treating, you're also listening. You are taking instruction, you are polite. Politeness is one thing again. But you're already coming with a bias. That place I'm going, how they be able to treat this my problem? Then the few who have the privilege to move out of the country with ordinary headache, I call it ordinary, because that's how they say ordinary, it's not mere headache. Before you know what is happening, the private jet is waiting at the airport for him to move. Whereas the majority who really need this health care, they are here wallowing and suffering and dying. And you see, when the patient is now coming to the hospital, the aggression of the fact that, oh, out of pocket payment, how much is my salary? Malaria, I'm going to pay 8,000. I earn 70,000 naira in a month. As it's coming, it's already coming with a bias, prejudice. If need be, ready to fight. Then you now call me, this is your bill. Before you know what's happening, say your bill is 9,000. You may not even be patient enough to explain to the patient.
Yeah, but you know, part of what they also add to that is that, look, even if they have all the best of the equipment,
Yes.
this personal perspective is a very important sector, because when you go to some of these hospitals, the first thing they tell you, well, if you don't pay a certain amount of money, even if you drop dead or whoever you brings drops dead there, they don't seem to bat an eyelid. And you ask yourself, these are supposed to be caregivers. And there are so many associations, and it seems as though nobody seems to be checking the meet up with the ethical.
But honestly, things are changing. For example, we have the ethics of our profession that tells us if emergencies are brought in, maybe road traffic accidents, burns, or whatever, even if the patient is coming in without a kobo, we are bound to start or initiate our first aid measures. Our association, we are the general medical practitioners in the country. We are the grassroots level. We are everywhere in all the 19 zones or districts in Lagos State now. We're there. And our rule is simple. You come in as indigent, you can't afford to pay, or you have an accident, you don't know what's happening. Please, we save that life first. We're not bent saying you must pay something, you must drop something. If you see a case of that nature, alert us.
How would you rate
really?
regulation?
Sorry, Mark, but how do they get to alert you?
Thank you.
Because we've seen this all
Thank you.
over the place.
On a regular basis.
Thank you. Look, Lagos has been distributed now, divided into 19 zones for the past 20 years by our association of general medical practitioners, private medical practitioners of Nigeria. And each of the zone also has officers. Like you see me as the state chairman, we have zonal chairmen and other officers. And we have consultants and specialists in general practice and private practice. We have them. And what we do is that we leave our numbers, we leave our email, we run meetings, we come in advocacy, we run conferences. And in fact, 2 days ago, we had our monthly meeting, which we hold every month in Lasut, that malaria research hall. And close to 300 doctors were in attendance. We hold these meetings, we do advocacy, we bring in regulatory authorities, they come to sit with us, Loma people will be there, blood transfusion people will be there, a farmer will be there, name them. And we also educate the society about us. So we are the friend of the common man on the road, because even in the time of strike, we also see how we cushion the pains of this patient on the road there. And you see the last train of strike in Lagos State, you saw what we did.
How would you rate regulation? Is regulation weak?
The regulation is not weak. The truth is this, it's not weak. Even there are penal measures for whoever breaks it, as it were. Like a farmer I'm talking about, I talked about the Health Facility Monitoring and Accreditation Agency of Lagos State. They monitor whatever we do all over the state. Not only hospitals, diagnostic centers, name it, they are there. And they call you to order whenever you make mistakes.
All right.
And exactly the truth of the matter is simple.
Yeah.
Our government should begin to look at what you call political will, total commitment, vote adequate budgetary allocation to health. Not politicize health. You can't politicize it, because you need to be healthy and alive to run other ministries and sectors. Immediately we politicize, these are things we should say. If we say this, we'll hurt the president. If we say this, we'll hurt the governor. I have to say this to help the local government chairman. Once you go into all of that, well, it means we are not prepared as a nation. We should sit down, determine our fate, like India, how these people did. They are coming to this country because this country is highly resourceful. But we sit on resources and we are preaching that we are poor.
We're out to end it, definitely. Thank you very much indeed, Dr. Adeyeye Aribagbo, who is the Chairman, Association of General Private Medical Practitioners of Nigeria. That's the Lagos branch.
Yes.
Thank you for coming.